I'm not sure we recognize the impact that this deadly pandemic has had on individuals with intellectual disabilities. An impact that has led to many of us witnessing firsthand direct support professionals potentially exposing themselves and their families to COVID-19. These funds will be used to help safely reopen day programs, ensure the health, safety, and welfare of those in need, and to help stabilize an area where staffing needs are most critical.
Now more than ever, we need to remember the people behind this work and the people who are cared for and loved as part of this work. That is why I'm proud to be here today asking for $540 million in COVID relief funding be dedicated to these important service providers. It is now our responsibility and our duty to make sure that we do not forget who needs these funds.
They weren't working from home. They were still getting up every day and coming and working with our most vulnerable population. I cannot imagine the amount of burnout and the degree and stress and strain that this workforce has been under over the last 15 months. And with my colleagues here in advocating for funding to be directed to this community to meet the needs and ensure those needs are met.
As we look at the sign, "Help me keep my DSP," it appears as a sign, but it is a cry and an acknowledgement of the importance of our DSPs and our facilities to be able to provide normalcy.
These providers are reporting crisis levels of understaffing due to inadequate funding. Direct service providers are essential to the health and well-being of our loved ones in the intellectual disability and autism community. Minimum wage is not enough to compensate for the work these individuals do. We need to invest in this workforce because an investment in them, those who care for some of our most vulnerable individuals, speaks to our values.
We need the state to provide relief. The system is collapsing. People's lives are at risk. As a mother to two young men who are nonverbal and have intellectual disabilities, I fear for their present and their future. I fear for how they will be treated when I am no longer able to stand here and advocate for them. Society already stigmatizes my family. Politics and bureaucracy should not marginalize us further. I want to thank the bipartisan support here today for believing in my son's lives. Your support of a $540 million request for federal relief funding to IDA providers is a statement of your values. I implore all state legislators to support $540 million in federal relief funding to IDA providers. The system is collapsing. My son's lives are in your hands.